All right, thank you all for joining us for today's webinar. We appreciate your attendance and your interest in this project, the Prevention and Family Recovery Project. Again, if you have not downloaded today's materials or did not receive them in your email, you can download those at cffutures.org/PFR. So today's webinar, again, is on Prevention and Family Recovery. It's the overview of the grant opportunity. Today you'll be hearing from Rosemary Chalk from the Doris Duke Charitable Foundation, who is supporting this project. You'll also hear from the Director of Children and Family Futures, Dr. Nancy Young. My name is Phil Breitenbuscher. I'm the Project Director for the Prevention and Family Recovery Project. Also, I want to introduce on our team who is here joining us for the webinar today is Kim Dennis, who is the Project Manager. Kim, do you want to say hi? And also Linda Carpenter joining us from her Seattle office. And also in the office here today is the Evaluation Director for the Prevention and Family Recovery Project, Dr. Chad Rohde. So,
good morning, everyone. Or good afternoon.
So we will try to address your questions. We know that many of you submitted questions when you registered for this webinar. We tried to incorporate those questions into the PowerPoint and into the presentation materials today. There were a few questions, however, that weren't necessarily related to the Prevention and Family Recovery Project and appeared to be more Family Drug Court technical assistance related questions. And so what we'll do, we'll send those over to our Family Drug Court TA team, and we'll have those responded to individually. But if there is a question that doesn't seem like it's been answered, or you have a new question, we really want to encourage you to use your panel box. So that's located, should be located on the right side of your screen. You should see a section there that says questions, and you should be able to hit the plus sign, expand that box, and you can type in your question and submit those to us. We have a team of staff here that will be monitoring those questions, and we'll address those questions at the end of today's presentation. We have allowed for lots of time to address questions. We don't think that the PowerPoint will take, or the presentation will take the hour and a half, so we'll allow for plenty of time for questions at the end. Also, if you would like to ask your question verbally, there is a way. We're not going to unmute the lines because we've had over 300 registrants. So if you did want to try and ask your question verbally, you would need to have entered your audio pin. So that would mean that in the attendee list, you're showing up as green. Your phone, you should see a phone symbol as green. And then you could raise your hand, and we'll monitor that as well and try to get to you. But probably the easiest way would be to go ahead and submit your questions in writing. We are recording this webinar so that we can post it to the website, and then those questions will also be recorded. And if we don't address every question during the webinar, we'll respond to those questions in writing and also post those to our website. Okay, again, thanks for joining us. Today you'll hear from Rosemary Chalk to provide some welcoming and opening remarks, and then Dr. Nancy Young will provide an overview of the PFR initiative. I'll come back later and talk to you all about who is eligible for this project and what the process looks like for selecting sites. And then again, we'll talk about some next steps and some questions. So at this point, I'd like to introduce to you Ms. Rosemary Chalk.
Thank you, Phil. This is Rosemary. I'm a consultant to the Doris Duke Charitable Foundation, which is based in New York City. And the mission of the foundation is to improve the quality of people's lives. They do this through grants supporting the performing arts, environmental conservation, medical research, and the prevention of child abuse and neglect. The foundation also works for the preservation of the cultural and environmental legacy of Doris Duke's properties. If you're interested in detailed information about the foundation, please see the website at www.ddcf.org. The foundation is especially pleased to support this effort, the Prevention and Family Recovery Project, at the Center for Child and Family Futures as part of the Child Abuse Prevention Program. And the mission of this program is to promote children's healthy development and protect them from abuse and neglect. I think it's important to note that Doris Duke, during her own lifetime, took a special interest in the needs of children. She supported nearly 85 child welfare organizations, many of them in New York City, during her life. And in her will, she expressed particular interest in the prevention of cruelty to children. Beginning in late 2011, so almost 2 years ago, The Child Abuse Prevention Program at the Foundation began a process of reflection and strategic planning, which led to a reframing of the program mission statement to focus more directly on child well-being as a desired primary outcome. And this led to a revision of its strategy goals as well. There are 3 strategy goals within the Foundation, within the Child Abuse Prevention Program. One is to build a repertoire of prevention strategies, which includes a strong emphasis now on place-based approaches. The second is to expand the capacity of existing systems, and the Foundation strives to use existing systems that offer a channel to selected populations that are characterized by high risk for child abuse and neglect, as opposed to targeting individual families. And by working within existing systems that already serve populations where risk is especially high, such as the family drug courts, we believe that more intensive interventions can be targeted effectively and efficiently. And the third strategy within the Foundation is to develop and disseminate knowledge. The Foundation is committed to building a broader audience for information that focuses on the prevention of abuse and neglect. In this particular grant, the Foundation believes that the Center's work in providing technical assistance and the competitive grants program that will be discussed here represents a very valuable and unique opportunity to disseminate research knowledge about effective parenting practices for populations that are frequently marginalized in studies of child abuse, particularly those populations that struggle with substance abuse. Through this project, we also hope to learn more about the strategies and unique strengths within those families that can contribute to our understanding in building early prevention efforts. I'm especially excited by this new initiative and look forward to discussion in this webinar. Thank you, Phil.
Okay, thank you very much, Rosemary. And now I'd like to introduce to you Dr. Nancy Young.
Great, thank you. And thank you, Rosemary, for the leadership that you have taken in the last year or so that we've been putting together this project together. And to the other staff who have done a lot of work so far and are looking forward to working with sites more directly. I'm the director at Children and Family Futures, and we feel very fortunate to have the support of Rosemary and her colleagues at the Doris Duke Charitable Foundation, as well as the Duke Endowment, which is specifically funds in the Carolinas. And you note that that says pending. They have a board meeting next week to join in with this project to fund a specific site in North Carolina. So we're excited by that opportunity also. As well as a national group that came together a couple weeks ago to advise us on strategies and ways in which we were looking at best practices and ways to pull together information that would be helpful to sites and to really sort of set the criteria of what are we looking for in advanced or well-functioning family drug courts. Some of the criteria that you've now seen in the letter of intent information, as well as what we'll be discussing today, has been guided by this national group of experts across all of the disciplines that are involved with family drug courts. You can see the advisory council members on our website at the link that you see at the bottom of this page. And again, we're very grateful to them for sharing their knowledge, their expertise, and their time and their excitement. And I see that some of them are registered on the webinar today, and I think that I speak for them with the excitement that was really expressed a few weeks ago as we talk about taking family drug courts and looking at the needs of children and families in a family-centered way. So the goals of the Prevention and Family Recovery, or you have to have an acronym, so PFR, as we've been becoming known, is to look at that service array of family drug court families and to specifically look at the relationship-based parenting services, things that have already been demonstrated to work in parenting, as well as the needs of children in terms of their specific development and therapeutic services that may have been established in the family drug court, or in some cases these are the two service areas that the family drug court has recognized they need to expand into, looking at this younger population of children from 0 to 8. We recognize that kids 0 to 8 come with older siblings, but that's the way that we think that it makes sense to focus these kinds of development and therapeutic services for kids. With a particular focus, and you'll hear this many times today and you'll see this many times in the material, it's about the family drug court capacity, the capacity to advance their own practice with families, to strengthen and to look at and to sustain more comprehensive family-centered care. And the part that you'll hear us say over and over probably is both the practice components of that, but importantly the larger system improvements about the collaborative service partners that are needed, about the way that communities support families, about how we look at policy more comprehensively to understand how to integrate the success of family drug courts into the larger child welfare and court systems. To do that, we know that we recognize that there are many strategies that have been put in place that integrate family functioning and a focus on family well-being in a prevention mode of preventing child maltreatment. Those kinds of strategies, to recognize them and implement them in these sites, means that we need to document those community conditions that support that implementation and the sustainability of those practices. And again, importantly, that each of those sites, as well as the Children and Family Futures team, as well as the National Advisory Council, have a responsibility to demonstrate and to then disseminate those lessons learned in a way that really begins to foster the leadership in the country around prevention, early intervention for families in family drug courts, as well as to increase more general awareness of the prevention and family recovery work and the accomplishments as we move forward as a country in dealing with substance use disorders among the families in child welfare. So when we say it's a departure from most grant opportunities, we really are looking at those broader sustainable system improvements. By that we mean the policies, the way that training is conducted, the way that funds are disseminated, the way information is communicated. What are those system improvements that need to be put in place to make sure that programs and allocations of resources support those outcomes for families that are at this nexus of the systems of child welfare, family courts, and substance abuse treatment. We're not talking about a family drug court that wants to add on a parenting component and evaluate that parenting component in isolation from the system changes that would need to be put in place to sustain that over time. It's not, as you have determined by the funding that is available to the site, not intended to be able to pay for child services and parenting exclusively. that those services that are available in the community and the linkages to those services are what's important. So ensuring that the glue, as we like to say, of collaboration is there, that the systems are responding in the community to this particular set of families in a way that is evidence-based, in a way that is responding to the comprehensive nature of the needs of families and children in child welfare and those that are participating in the Family Drug Court. So when we say it goes beyond the boundaries of this project, we know that many family drug courts have a small population that they serve in relationship to the number of families that need those services in a community. So one of those questions right now is, what is the penetration rate? Do communities know their own penetration rate? Are there goals about how to penetrate more broadly into the child welfare population, into the family court population that goes beyond the boundaries of a project that's confined and frankly sometimes we say sits off in an island by itself, that if the family gets referred to the Family Drug Court, they get these comprehensive services, but it sits off to the side of the way that most families get services. So we're talking about ensuring that families get those services as well as looking at the systems about what happens during the Family Drug Court initiative as well as what happens afterwards. It means that it's a community that wants to have a feedback loop that is guided by data, that has an information system that can provide feedback back to the Family Drug Court and to the larger community policymakers, that is willing to be a learning organization, that wants feedback from its collaborative partners, from its family, from the wider community in order to continuously improve the way in which it's addressing comprehensive family needs. We recognize that it takes dedicated funding. It often takes dedicated staffing, that to make these kinds of changes institutional in any system doesn't happen by magic. Sometimes it needs magic, but it's not magic alone, that it takes dedicated staffing with knowledge in collaborative practice, ways in which both relationship-based and data-based information comes together in order to improve services. And we like this last one. For those of you who have heard Sid Gardner over the last 20 years, he talks about communities that have a policy-making team and that are the barrier busters, that when barriers come up, that either families or staff or program managers, administrators recognize this is a rule, this is a barrier, this is a policy, this is a funding constraint that is acting as a barrier to the well-being of children and families, that this group accepts their role as being barrier busters, to understand what that barrier is and how within their community they're able to solve that particular issue, that they become the targets for systems change rather than acceptance of the status quo. So we're excited by that opportunity to look at that. Why family drug courts? I think both the Doris Duke Charitable Foundation as well as the Duke Endowment staff recognize that family drug courts are a growing response across the country. Some now more than 360 initiatives that are specifically focusing on substance use disorders and child maltreatment, and that they have shown that there is a strong system of accountability and results from their efforts. Both accountability with families and staff, but also accountability for the systems to work together. that's a way that some of those barriers can get identified and that some of those barriers can get busted. They have the capacity to provide substance abuse treatment to parents. The family drug courts that are operating have spent the last decade, in many cases, sometimes longer than a decade, really understanding families, substance use disorders, what's going on in the clinical aspects for families with substance abuse issues, and how to provide substance abuse treatment to parents in a way that responds to the early needs of families as well as the ongoing support for recovery that's needed. We also recognize that the judicial oversight of the program and families, that is a key component that needs to be in place often in order to achieve these cross-system improvements that we're looking for. So in brief, as you saw in the materials, there will be 3 and potentially a 4th that will be specifically in North Carolina, experienced family drug courts with up to a 2-year project period, working with Children and Family Futures, the Doris Duke Foundation, the Duke Endowment, for up to $225,000 with some flexible dollars and how those funds can be used. It's intended to be new or expanded or enhanced parenting services and the child development or therapeutic services, meaning we must do both parenting and child-focused interventions. It's not intended to pay for substance abuse treatment. When we're looking for well-established family drug courts, those linkages, that need for substance abuse services has already been identified in the community, and there has to have already been some solutions to how the family drug court either has community resources that are part of the partnership or has gotten priority for access for services of the existing the existing substance abuse treatment services. And the funds that are included must cover the travel, that there will be 3 leadership trainings that will be part of the grant funds to come to those trainings. So what do you get beyond that amount of cash? CFF, as some of you may be familiar, have about 20 years of experience with looking at these issues of the systems and practice with substance abuse child welfare in the courts. Our senior level staff, who are highly experienced in collaborative practice and some of the best skilled facilitators that we think are out there in the nation at looking at systems improvements and sustaining systems change, will be change leaders that are dedicated to each of the sites that are funded. Also, that list of the nationally recognized experts, you will have access to them for on-site work, for the cross-site meetings, but also a lot of web-based kinds of TA as well as web-based training that can happen, and on-site to work with your partners when we identify that that's something that's needed, that looking across the service spectrum of the comprehensive nature of needs of families means that there are experts that have done that before, that have addressed the challenges and the barriers that you might be addressing, that can come to your community or you can have access to help you solve those issues and to work with your community partners in a way that advances practice and improves the outcomes for the children and the families that we're talking about. Again, some of you are familiar with the technology that Children and Family Futures has developed over the last 10 years in terms of working with sites creating some interactive dialogue. Those of you who've been part of the Family Drug Court Learning Academies know that we've developed ways in which communication and information sharing can happen a bit more efficiently, as well as the high touch that, again, some of you have been able to experience through other grant programs, that the expertise of the change leaders, personally, I think is unparalleled in terms of this topic and the ability to really affect change in communities. So we're very happy to have the ability to bring together both of those. So in short, the PFR activities are about supporting communities in sharing both the experience and the research-based knowledge about parenting practices with this set of families, as well as the child-specific interventions that are needed, building the infrastructure that integrates these new ways of practice and expanded services into the larger family drug court systems of care, that we are advancing the ability of communities to institutionalize collaborative capacity and leadership, to have this ongoing systems improvement approach that focuses on strengthening families and serving the children at the nexus of these systems. And again, looking at the sustainability of comprehensive family-centered care that's focused on positive family outcomes. The PFR team will work with each site to look at specific measures of success. The evaluation team headed up by Dr. Rohde will be working with the sites directly to ensure that those evaluation measures, as well as, importantly, the organizational capacity and the systems improvement are understood and collected and measured and reported on and disseminated. So while we recognize that it's critical to know the child and the family functioning and any changes in child and family functioning as a result of these interventions, but it also has the need to have data collection at the organizational level as well as the systems level. And the evaluation team will be responsible for doing that. So in the what's required component, grantees are agreeing to participate and to facilitate that stakeholder participation in interviews and focus groups and surveys to understand those larger systems issues, to implement a measure of parenting and family functioning that will be identified in collaboration with the PFR evaluation team, to provide the aggregate findings related to those specified measures of success. We don't anticipate that grantees will be hiring local evaluators out of their grant money, but that they will be willing to actively participate in the evaluation process, and we'll be looking for those commitments from the system data folks as well as the system stakeholders that can give those kinds of permissions about accessing individuals and data that are needed to monitor those outcomes. With that, I will turn things over to Phil. I recognize that we've had lots of questions coming in, so we'll get back to those after Phil has a chance to talk about what do we mean by minimum criteria for family drug court applicants. Phil?
Thanks, Nancy. And so again, yes, as we continue on, I do encourage you to submit questions if you have them using your panel box to the right. I can just go ahead and submit those questions to us in writing. So what do we mean by eligible FDC applicants and minimum criteria? Really what we're looking at is 4 kind of major areas or major domains. First of all, as Nancy spoke about, we're really looking at experienced family drug courts. So these are drug courts that have been in operation for a while, and you've shown success in operating your family drug court, and so we're looking at You've already built the bridges with your substance abuse treatment agencies. You figured out how to get access for parents to access treatment, to be assessed, higher quality treatment, and in some cases you've already built in treatment access to family-centered care. We also are looking for courts that have current or planned parenting services and developmental therapeutic services for children, and what we mean by that is that maybe you already have connected with the parenting program, but it's missing, it doesn't serve the full range of age of children that you're serving in your family drug court. You would like to expand upon that. Or maybe your community, your child welfare system, does a great job of doing some developmental screening for children, but you haven't necessarily connected with that agency in your family drug court, and that information isn't being brought back to the team in a systematic way to ensure that the needs of those children are being met, that information from those developmental screenings or interventions are being shared with the team, and collaborative interventions are being put into place. So we'll talk more about that in a minute. And then we're really looking for folks who are ready for this type of change, who have the capacity for system improvement. And I'll talk a little bit more about those things. So basic FDC operations. Again, we're looking for folks who have been in operation for at least 3 years, but preferably 5. We understand that when you start a family drug court, it takes a few years to build a relationship with the treatment providers, to work out the kinks with how referrals are made into the system, with understanding the needs of your particular target population, training your staff. All those things take some time to get up and really get a firm grasp on what a family drug court needs to be doing. How you share information, how you conduct your staffings, all of those things. We want all that to be worked out before we take this next step. We would like courts to be serving at least 30 families at any given time. We know that in North Carolina, that the minimum standard is 24, and so there may be an exception there, but really we want to see courts serving at least 30 families at any given time. This is for a variety of reasons. One is that we want to make sure that we're getting enough families into the program and into the new services so that we can really see the change that we want to see at a systems level. We want to see that you've had a demonstrated history of effective cross-systems collaboration, that the partnerships have been committed, that this isn't an isolated, just a court program working in isolation from the child welfare or treatment system, that you bought your own treatment, that you don't necessarily engage with the child welfare system, but you're working collaboratively across systems, and those partners are committed. We're looking for you to already have some type of data collection system where you're tracking your outcomes on a regular basis, and you've demonstrated positive outcomes for key indicators. And so for those of you that have been doing family drug court work for a while, you know what those key indicators probably are, such as timeliness to permanency or timeliness to reunification, reduced recurrence of maltreatment, reduced reentries, keeping children home. Those types of key indicators, you've already done some evaluation work, you're tracking that on a regular basis, and you've demonstrated positive outcomes. And of course that you agree to participate as active partners in this project evaluation. For current substance abuse treatment, this is much in line with the adult drug court standards, standard number 5 that just was released, and maybe a little bit beyond what those minimum standards are for drug courts. And that we're asking, again, we're looking for courts that have well-established relationship with their treatment providers, and that parents have timely access to treatment. That we would look for courts that are able to get parents into treatment within 7 days of assessment. So parents that are assessed as needing treatment aren't sitting on a waiting list for 60 or 90 days, but they're getting into treatment right away. We're looking for courts who are retaining parents in treatment on a minimum of 90 days. Better courts that we've seen as evaluations, the courts that we've worked with are really closer to 125 to 200 days in treatment. And that's a mean score, obviously, or an average of a minimum of 90 days in treatment. That we're looking for courts that are providing trauma-informed and gender-responsive treatment. We're looking at family-based. At a minimum, children may attend treatment with their parents. Children might not be yet receiving therapeutic services, or they may have been. Obviously, when children are in foster care, this becomes much more difficult, but at least that the treatment providers you're connecting with have some type of capacity for children to attend, if appropriate. That your family drug courts are addressing the co-occurring health and mental health disorders of your parents, or you're at least recognizing that and beginning to address those issues. We're looking for courts that don't exclude parents who need medication-assisted treatment. If you're excluding parents who need MAT, then you're not qualified for this program. And this last one is that we're looking for courts who have some type of engagement specialist. Many of you who have heard us talk in the past, done presentations, you often hear us talk about the story, if you build it, they won't come. And we have found with family drug courts that you really need to have an engagement specialist, whether it's the recovery coach, a substance abuse specialist, some type of treatment navigator or systems navigator, dedicated workers. There has to be somebody in your court program that engages these folks and gets them into treatment and keeps them in the program, and it goes beyond your standard business as usual case management. And again, this is because of our experience working with other grant programs where they have trouble maintaining the number of clients necessary to show change. Parenting services and child developmental therapeutics and child development and therapeutic services. We're looking for courts that might have been providing some of these services but not all, or that you're providing them on a limited basis, or that you know that their services are somehow available in your community but you're not necessarily connected to them in a direct way with your family drug court, and you'd like to connect better. Nancy spoke about the glue. So how do you bring those child developmental services that are available in your community, how do you better connect them to your family drug court, and so that information is being brought back into the program? How there may be a parenting initiative in your community. Many child welfare organizations across the country have really engaged in evidence-based parenting interventions. Your parents may or may not be getting access to those services. Also, those parenting services may or may not be addressing the substance abuse needs of your families. So looking at how do you better connect to those services, how do you enhance those services so that you meet the full age range of children who are coming into your family drug court. We're looking for evidence that you've engaged in some thorough and thoughtful assessment about the strengths and gaps of these services in your community and how you connect to those as your family drug court. And that you have some way to have documented the need for this new or enhanced or expanded services, specifically with a focus for children 0 to 8. What we learned and what we've been discussing is that it's such an important that your parenting specifically, parenting interventions have an alignment of fit with your family drug court and with your family. So knowing who you're serving, what the age range of children are, and that your parenting program addresses the needs of those parents, where those parenting interventions are put into place, meaning at the time of the parent's recovery, where they're, once they've engaged in the family drug court, are they getting access to appropriate parenting, relationship-based programs? Do they meet the full range of the child's age or developmental status? Those kinds of things. So have you thought about how well your parenting and child developmental therapeutic services align with the target population of your family drug court? We're looking for clearly articulated goals and how you're trying to achieve those. And again, you demonstrate the ability and readiness to forge new or strengthen existing partnerships and linkages. This is a fairly short grant. It's only 2 years. So if you have very little infrastructure or you haven't begun to develop partnerships in your community or identify potential partnerships, again, this is going to be a difficult opportunity for you. We're looking for programs who are say, gosh, we know that there's this great parenting initiative happening in our community, and or a nursing in-home parenting program, or developmental program, or early Head Start program, whatever your identified gap is, but we just haven't necessarily built that bridge yet to connect to that program. But we know it's there, and it's something we really struggled with, and we think this is an opportunity to take that next step. That's who we're looking for this project. So what we mean by readiness for change is that, first of all, you have to have evidence of judicial leadership. We want the judicial leadership to be clear and demonstrated. We need key partners' commitment and how they can contribute to the effectiveness and the benefit from this initiative. That you've as I spoke earlier, you've begun to identify those new partners or how you can enhance existing partnerships. Maybe there is someone who comes to stakeholder meetings, but they're not yet incorporated into your regular staffings. Maybe that there's some ancillary program that some of your parents are connecting to, but you'd really like to expand it to all your parents, those types of things. And again, there's been some initial effort to document the barriers that might prevent your family drug court from achieving these goals, and that you can think about how you're going to really use this program as a barrier buster program. So again, I talked about this. You may be aware of parallel reform initiatives in your community that might both benefit this project or become a barrier. For instance, if your community is really now focused on a program like differential response or reducing foster care caseloads, so in other words, keeping children home, but your family drug court only focuses on out-of-home care, we want you to be aware of that initiative and how you might be making adjustments to your target population to address that barrier. We want you to be already collecting or committed to collecting the data necessary to report on aggregate findings. So we'll be, as Nancy spoke about earlier, we will be asking you to use some type of instrument to look at family functioning. We'll also be doing a lot of stakeholder interviews and surveys. It's a highly qualitative evaluation that we're implementing here. But we want to see that you already collect data on your family drug court and how you match against the larger systems. So the larger child welfare population, the larger substance abuse treatment population, and you're able to track those admissions and those entries into care. So getting into the site selection process, how are we going to identify these 3, hopefully 4 sites? First, what we're going to ask you to do, and you all received the request for letters of interest. First of all, if you feel like you do meet the minimum criteria, and this is a project that you're interested in, we ask that you submit a letter of interest to us, and there's instructions in there on what you must tell us about your program. Then, once we will screen those letters of interest, and qualified sites will be asked to submit a full proposal. Those proposals will then begin, in addition to how you implement it, will also be a full application for funding, how we use the funds. Those sites that then are scored highest, a maximum of 8 applicants with the strongest proposals, will receive an on-site consultation or on-site visit so that we can really come on-site, look at your court program, potentially identify any technical assistance needs you might have so we can begin developing a TA plan for your program to help with full implementation of the project. Here's the timeline in brief, where the letter of interest was released actually yesterday. It's posted now to our website. They're due November 22nd. We will be turning those around fairly quickly. Some of you that submit letters of interest, you may receive a phone call or emails from us asking clarifying questions. Those results of those will be notified sites. If you are going to be asked to submit a full proposal, will be notified the week of December 2nd. The RFP will be released as that week of December 2nd, and they'll be due back to us by January 17th. Again, there may be some clarifying questions that are asked of you, and then based on those highest scoring proposals, 8 sites will then be be asked to participate on an on-site consultation. It begins in middle of February to mid-March, and then announce awards at the end of March. And then there's a grantee meeting, leadership training that will be required of the final selected sites in May, the beginning part of May, the 12th to the 14th, that will occur in Newport Beach, California. So that you'll need to be prepared to attend those if you are selected. So that's kind of the overview. So in summary, we're seeking to work with established and experienced family drug courts, demonstrated experience, existing capacity to provide family-based substance abuse treatment, and current or potential capacity to effectively meet the family needs of parenting services and child development and therapeutic services. We want to see that you have capacity and readiness to engage in larger system improvement and change process, that you are established or you're willing to participate in the evaluation, and you're already tracking key outcomes, and that you have the capacity or willingness to participate in the larger PFR project evaluation. I've already spoke about these 4 intersecting areas that we'll be looking at. It's the systems collaboration and improvements, parenting services, child development and therapeutic services, and your substance abuse treatment services. So before I get to questions, I just want to encourage all of you to go to our website. We're continually updating this PFR website. You can learn more about the National Advisory Council members there, who our project staff are, what the PFR evaluation design looks like. The letter of interest is now posted to the website, and as more information becomes available, that will all be posted to the website. So we do encourage you to go to the website to learn more information about the program. This is our contact information for the key staff assigned to the project. So let's get to questions. We know that many of you submitted these, and I know that some of these have been answered individually that we're responding back to you.
But there might be a broader audience who's also interested in some of those.
So let's take a few of these, and I'll respond to these questions so that you can hear what kind of questions are coming in. Again, as I said at the top of the presentation, all of the questions that were submitted in writing will be posted to our website so that you can see the questions and responses.
So one of the things that has come up a couple times from the questions are related to the capacity issues. In particular, a state that has a 25-person cap on who can participate in the Family Drug Court, others that don't have the current capacity to expand beyond the 25. What's the thinking on that in terms of eligibility?
Well, at this point, where we're at is that North Carolina, there may be an exception. We understand that there's a state standard of 24, and because the Duke Endowment is looking to fund a site specifically in North Carolina, there may be an exception there. For the other sites, we really are looking for sites that can serve a minimum of 30 families at any given time. And again, this is based on experience, and the National Advisory Council felt pretty strongly that you needed a minimum number of families in order to really be able to see the type of changes that we're looking to implement with this project. So, so going into that a little deeper, when you have 30 families at any given time, you're going to have a variety. Those families will be in a variety of stages within the phase or phases within your family drug court, and so when they will need access to developmental services, when they will need access to parenting will vary, and needing a larger sample size to see how those changes are effective, how you built relationships, how you've been able to break barriers such as transportation, the cost of implementing some of these services. Those types of standard systems barriers that if you're not serving at least 30 families, we might not be able to see and therefore learn from. I don't know if anyone else, Linda or Kim, if you wanted to add to that, or Nancy.
One of the other questions that's come up is paying specifically for substance abuse treatment. Can you talk a little bit about the discussion at the Advisory Council about that in particular, and the recovery coach or the navigator, that kind of service as compared to paying for an outpatient slot or a residential bed? What's the discussion about that?
Yeah, and Linda, please jump in if you'd like to. So again, as we've spoken about, both Nancy and I today, is that we're looking for family drug courts who have already kind of figured out how to build relationships with substance abuse treatment, and that you are working collaboratively with them and have redirected funds or prioritized treatment slots to ensure family drug court parents have access to that treatment, and that this really is intended to these funds are really intended to coordinate services, maybe pay for a coordinator or a navigator, as Nancy spoke about. It may also help pay for some of your parenting treatment training and even parent treatment services with a provider to get started. They're very flexible. We're just saying they're not intended for treatment. We understand that sometimes the treatment provider might be your parenting services provider. In that case, it might be appropriate for those funds to go to a treatment provider.
I think,
but these really aren't meant to expand treatment. Yeah, go ahead, Linda. Thanks.
I think one of the discussions with the advisory council was that when you look at family drug courts, the treatment piece for parents is typically the piece that already exists and needs to be there. And that when we looked at the pieces that are often missing, it's that parent-child relationship piece, it's that child development therapeutic piece that's often missing. And sometimes what's missing is that navigator or that specialist that's going to help them access services. And so that was really the impetus behind saying pay for possibly that navigator piece, but not treatment per se.
Thanks. There was another question, that, just a point of clarification. The $225,000 is for both years, not per year, so it's a total grant of $225,000. So again, we recognize this is not a large, huge amount of money, and again, why we're looking for this to be really about, as Linda just said, a navigator person or someone who's coordinating these services, but as flexible as needed for your community.
One of the participants asked or commented that they currently have Celebrating Families operating in their family drug court, but they are not currently evaluating that. So could you speak to, would this be appropriate for this program? And then, Dr. Rohde, there's also some questions about the evaluation itself. Can you talk a little bit about what is required of the grantees?
Yeah. Linda, do you want to take a first stab at the Celebrating Families, and then we'll go with the evaluation second? Or I could start, Linda, and you can add to it. The question was with regards to, is this inappropriate for a drug court, a family drug court who is already implementing Celebrating Families? I would think, or some considerations could be a few things. Yes, you would be appropriate. One of the things we know about Celebrating Families is it does not currently, I know that there's curriculum in development, it doesn't address the 0 to 3 population, so we would be asking you how you plan to address that population. We would also be asking you that, and yes, that's a great start, and we commend you on that. We'd also ask that how are you ensuring the developmental needs and therapeutic needs of the children are being addressed, and how can these funds be used to evaluate the the Celebrating Families program? That question specifically is that there will be some, and Chad will speak more about this in just a moment, but there will be some family functioning assessments happening with your program. I'm not necessarily sure that this is intended for an evaluation project where you would conduct maybe a randomized clinical trials and Celebrating Families or something to that nature. It's really about connections. But Linda, you want to add to that?
No, I think you covered most of it, Phil. I think one of the things that we've learned, Celebrating Families is an excellent model with family drug courts, and they are in the process of adding the 0 to 3 piece. A lot of courts adopted Celebrating Families, and at the same time we're serving families with very young children without realizing that that model, that particular program really wasn't appropriate or didn't address, not so much not appropriate, didn't address the needs of parents with really young children. So as they refine that model, as they add that 0 to 3 piece, then how do you implement that? How do you build that into your existing model? How do you work with our evaluators to evaluate the success of that strategy? And then also how do you integrate the other parent-child relationship and child development and therapeutic pieces into that? It's not, I think it's important to recognize, while it's an excellent model, it's not going to address the needs of the children without looking at the developmental and therapeutic pieces as well.
Okay, great. Thanks, Linda. And Chad, would you mind speaking about just giving kind of a quick overview of what the PFR evaluation will look like?
Sure. So really broadly, the evaluation is focused on, just like the project overall, is focused on capacity building. So the evaluation component will focus on the priorities that have been identified by the funded grantee, and looking at available data, breaking down barriers to accessing that information if there are barriers, but more importantly, building local capacity for using that information to guide improvement efforts, expansion efforts, and so forth. So there's a big technical assistance component. Now, that whole process will also be documented by the PFR evaluation team, and we will be on site along with the change leader from CFF to ensure that the program development, systems capacity development, as that goes, so will the evaluation hand in hand, and we'll be documenting that process. There is one potential add-on component, and I say potential if it's not already existing within the grantee community, and that would be, as Phil mentioned, in the area of family functioning. So if there's not currently a tool or evaluation instrument that is being used in the community for evaluating family functioning among their participants, we will be working with grantees to select an appropriate measure for that process. But those are the sort of the broad brush of the evaluation.
Great, thank you.
And Chad, there were some questions about 30 individuals, 30 families, 30 for the whole state, 30 for the family drug court. Can you clarify that a bit?
Yeah, I'll take that one. So we are looking for a minimum of 30 families being served at any given time in the family drug court. We recognize that that's it's the average in family drug courts across the nation is somewhere between 40 and 60. So this is just under the average, but still a fairly well-functioning family drug court and high number of parents.
By the way, it sounds like, I hate to take on a challenge here too big, but it sounds like that capacity of 25 or fewer, I guess it's 24 or fewer, might be a good thing as a target for a barrier buster.
Yeah. There, just real briefly, someone asked, can this be used for existing programs? And I think Nancy did respond directly, or we did respond directly to that question online, but just so others, because we've heard this question prior to the webinar also. And again, this is not to supplement existing activities. However, if you are, you may have an existing program that you're looking to enhance or expand or to improve upon. And so in that case, that we're not necessarily looking to reinvent the wheel. You might be referring parents, I should say, to multiple parenting programs in your community. And that may not be done by the family drug court. It might be being done by the child welfare system. And it's kind of a shotgun approach. And so your goal might be to not necessarily recreate parenting programs, but better identify what parenting programs in your community would be most effective for the parents and families in your family drug court, and how do you better streamline those referrals into the most effective parenting programs, and how do you better share information with the parenting program or that provider and to your family drug court team so you're maximizing that experience for your families. So just again, one example of how there may be existing programs in your community, but you're really looking to enhance the capacity of the program and the system.
There's a question about the medically assisted treatment or medication-assisted treatment, and in particular a site that currently accepts those clients but works toward a plan to eventually come off all of the medications. And I guess I would add to the discussion on that if that was being advised and sort of the case plan for the management of the addiction was being supervised by a physician, preferably somebody who's ASAM certified, American Society for Addiction Medicine certified, and suggesting that they should come off all medications, I think that would be something that we'd want to be able to look at. But there are many individuals who are participating in family drug courts who have co-occurring mental health issues that may need ongoing medication. So I guess we'd probably want some more information about how that's evaluated, who makes the determination. Is that the court making a determination about a medication, or is it the physician who's managing the treatment who's really making those decisions about the medication? Someone else asked about using these funds to start a 0 to 5 court. and I think we've probably answered that in that these are existing family drug courts, not startup courts. They've already worked out treatment for parents and are looking at those parenting and services for children that would be enhanced, augmented to serve the families that are in the family drug court. Anything else that Linda or Phil you want to add to that?
I think that covers it, Nancy.
Yeah, I think we've covered that.
Yeah. So I think that also answers the question about could it be a child, could this fund a child therapist for the team? Again, in that navigator, coordinator role, it is not envisioned that these are direct service dollars. We recognize it's not enough funding to pay for direct services for very many families, probably not even the 2 years of 60 families with that fund. But if it is a child therapist who is helping to connect to the existing children's service array in the community, that might be something that we'd want to talk some more about.
You might also want to look at using the dollars if you're looking at children's therapeutic services and you have a child development specialist in your area. How might you use these funds to start that and leverage that, recognizing that over time you can probably draw down other sources of revenue to fund that position. But the important piece is that you want to be able to start something and implement something that you have very strong likelihood of sustaining over time as well.
Let's see, there was a question about can the nonprofit collaborate with the Family Drug Court for this funding, and I think we'd want to hear more specifically about the partnership. If the nonprofit is the applicant organization, that certainly would be something we'd want to look at and encourage to have that partnership, but we would certainly be wanting to understand both in the application process and in the on-site visit the strength of that partnership, the strength of the buy-in of the court and the child welfare and the treatment agencies. If the nonprofit is the treatment agency and you've been acting in that role with a family drug court and have a strong partnership with the court and child welfare, that certainly would be something that we would think as a strong family drug court. In other words, it doesn't have to be the court who is the applicant or child welfare or treatment. In our experience, we've seen all three of those systems come forward as the grantee, if you will, but we also recognize that looking for the strength of the partnership goes beyond a letter of agreement that's submitted with an application.
There was a question about how the evaluation, who will evaluate the proposals. So I think I did speak about the process of that. The letters of interest will be reviewed and screened with PFR staff, and then those results will be shared with the National Advisory Council, shared and also counseled by the National Advisory Council. And then once we move to the RFP proposal section, there will be peer reviews. There'll be panels of reviewers for every RFP or every proposal submitted. That will consist of both PFR staff and outside peer reviewers as well as National Advisory Council members. Those results will be aggregated and then and put together and also again shared and consulted and approved by the National Advisory Council, and that process will continue all the way through site selection.
There's a question about the exclusion of parents who are on methadone, and does that disqualify the court? And I would go back to who's driving that decision. If that is a qualified physician who's making clinical determinations about the need for methadone, buprenorphine, Suboxone, naltrexone, any of the medications that are shown to be effective with opiate and alcohol dependency, alcohol addiction, opiate addiction. If there are clinical reasons why that decision has been made, we would want to understand that. But if this is a physician who's trained to treat addiction, then having the full repertoire of medications that are available for addiction, as well as the full repertoire of medications that are available for co-occurring mental health issues, we'd want to understand more about that decision, and if that's being driven by addiction medicine or medicines that are specific to co-occurring mental health issues. Question about making sure that they're understanding, can the money be used to contract for parenting and child family therapeutic in an already existing family drug court? Yes. We recognize that many family drug courts have the strong partnership with treatment agencies, and in fact many treatment agencies have added family-centered approaches to parenting, and many have added therapeutic services for children. But we also recognize that many have not, and this is about ensuring that parents and their children have relationship-based proven parenting strategies that have been put in place, as well as the interventions that may be needed specific to children. And by that we mean the full spectrum of not just child care. We mean recognizing that many of the children that we're talking about have both pre- and postnatal exposure to substances that may have some neurodevelopmental components, sensory integration components, other kinds of specific interventions that the child needs, as well as the parenting component that works both with the parent and the child. So if that still isn't clear, follow up with us. We'd be interested in talking more specifically if there are some other questions about that. There's a question about a juvenile drug court that includes family counseling. If the offending, or if you will, if the child who is the participant in the juvenile drug court is also subject to a dependency petition. In other words, we recognize that there are many adolescents that are, if you will, crossover. But you may have noted that the target population is 0 to 8. So probably those are not kids who are participating in the juvenile drug court. There may be older SIBs who are participating in the juvenile drug court of that 0 to 8-year-old. But that is the focus of this particular initiative, are the younger kids.
Yeah, we've gotten questions from several types of different types of courts. So adult drug courts who would like to implement some type of family services, juvenile drug courts who would like to provide more family-centered care, baby courts, other types of collaborative problem-solving court models who are interested in this project. And first of all, I'd like to thank you for being more family-centered and trying to be innovative and connecting to us. And if this project is very small, and so we really are looking at well-established family drug courts who are looking to add on these additional pieces. We anticipate that the results and the lessons learned from this project over the next couple of years will really help inform those other type of problem-solving courts in expanding services to families and children. However, in the meantime, you might determine that this project or this grant opportunity is not for you, but if you would still like technical assistance on that, we'd be happy to work with you through our other contracts. So please feel free to contact us and let us know that you're interested in technical assistance, and we'll see what we can do to help you out in expanding services to your families?
I believe we have addressed all of the questions that have come in through the chat box. I understand from Jonathan, our IT specialist, that we have lots of emails that have also come in. So again, check back to the website. We will be on an ongoing basis responding to questions that we get so that everyone has that information. And those specific that came into the email versus through the chat box, we'll make sure that we get responses back. And as Phil just noted, some of the questions that we received are more Family Drug Court Technical Assistance specific, and we're happy that we're able to respond to those in a Family Drug Court TA role that are not specific to prevention and family recovery initiatives specifically.
Right. So again, thank you all for your interest in this project. Thank you for wanting to expand services for children and families and for the work you do in your communities. And we thank you for joining us today. Have a great day. That will conclude today's webinar.